Imagine you are making an important call, and suddenly the line drops. You'd be incredibly frustrated, right? Now step away from everyday gadgets and walk into a hospital. Here, we rely on the peripheral IV catheter, a tiny plastic tube that is the most common invasive medical tool in the world. Its job is to provide a direct line for fluids and medicine. Because it is so fundamental to modern care, up to 90% of all hospitalized patients will need one. We'd expect our consumer electronics to work perfectly every single time, yet we don't seem to hold this critical, life-saving medical procedure to that same standard of reliability. This graphic shows 100 standard IV lines. In the real world, 35 to 50% of IVs fail before they are finished. This isn't a problem unique to small clinics. This high failure rate persists even in world-class research hospitals, where highly trained specialists are the ones placing the needles. A failure means the IV stops working safely. When that happens, a nurse has to pull the plastic out and start over with a fresh needle, forcing the patient through the process again. In industries like aviation or telecommunications, a 50% failure rate would trigger an immediate investigation. In our healthcare system, it is simply treated as a normal part of the day. These failures happen because we are taking a stiff, manufactured plastic tube and placing it inside a soft, moving human vein. Matching rigid hardware with a flexible body creates several physical breaking points. In this cross-section, you see infiltration. The plastic tip pokes through the vein wall, leaking medication. Next is occlusion. The tube kinks or a clot forms, blocking the medicine. Finally, dislodgement. Without secure tape, a simple tug pulls the catheter out entirely. These complications are the logical result of putting medical hardware in a living, moving body. When the equipment can't adapt to the patient's movement, the system eventually breaks. The body also reacts biologically to the foreign object. If the plastic scrapes the vessel or the medicine is too harsh, the vein becomes painful and swollen, a condition doctors call phlebitis. When this happens, it often leaves a visible red streak on the patient's arm. Because the vein is inflamed and sensitive, the IV must be removed immediately to prevent further injury. Bacteria naturally present on your skin slide down the tube. Regardless of whether the cause is a microscopic infection or a kinked tube, the result is the same. The IV has failed, and the whole procedure has to start over. For the patient in the hospital bed, a failed IV means more than just swelling. It means extra pain, more needles, and the anxiety of wondering when the next line fails. Every time a vein is damaged by a failed IV, it leaves behind internal scarring. This uses up the usable veins in the arm, a process called venous depletion. Over time, those healthy pathways shrivel and gray out. This cycle makes a routine hospital stay much more difficult. It forces the patient to endure the stress of repeated, difficult needle sticks at a time when they are already physically exhausted. These failures are not just minor inconveniences. They are compounding physical injuries that make it harder for the patient's body to receive the medicine it needs to heal. It's important to realize this isn't usually the nurse's fault. Frequent IV failures are a sign that the equipment itself is struggling to do the job we're asking it to do. In the US alone, hospitals buy over 300 million IVs every year. At $30 per attempt, failing half of those lines waste billions of dollars annually on equipment and reinsertions. This timeline shows how a nurse's shift is affected. When this red icon drops, the nurse has to stop all other care to find new supplies and troubleshoot a new vein. A faulty catheter initiates a costly domino effect. It drains time, money, and medical attention away from every other patient on the hospital floor. For a long time, hospitals were required to pull out every IV after 3 or 4 days, even if it worked. This was done to try and get ahead of possible infections. Modern standards have shifted. Now, the goal is to leave a well-functioning IV in place for as long as it's needed, only replacing it if the line actually shows signs of failure. However, this strategy only works if the medical industry improves the technology and training. We need catheters and tapes that can actually survive for more than a few days without breaking down. We should expect more from our medical tools. Tell your care team immediately if an IV hurts or leaks.